The breakthrough new machine that's changing the face of surgery as we know it. Minimal scarring and back home in just 24 hours after major surgery. You've got to see this.
Second to C-sections, hysterectomies are the most common procedures for women. Our guest Annette just found out that she needs one, and thanks to a new machine called the daVinci, the methodology of your grandma's hysterectomy is becoming a thing of the past. The robot specialist, Dr. Sherry Levin, who says this new technology is changing the face of hysterectomy surgery. She's here today, and the first question, beyond thanks for being here.
Thank you for having me.
Is Annette, who's so worried about traditional hysterectomies.
How are you?
A candidate.
Is she a candidate? From the history I've heard, not only is she a candidate, she's the perfect candidate. Because if a hysterectomy is what she decides on, she is somewhat complicated. And the traditional vaginal hysterectomy, you're too complicated. The traditional laparoscopic hysterectomy, I could do it, but it'd be very difficult. The robot, the daVinci, that gives me the tools I need to do someone complicated like you. And the last alternative is I can make a big old incision here, like they did on me 10 years ago, that hurt like the dickens. Or I can make 4 tiny incisions, have you out of the hospital the next day, and back to work in a week. And, you know, which would you choose? I mean,
well, I heard you during the break. You're not just excited about this technology, you're in love with it.
But this is better than sliced bread. It is the coolest thing to come out, and there is no one in my mind who is not a laparoscopic daVinci candidate.
This tool is just amazing. I mean, it's robot-assisted laparoscopy. You still need, you know, everything out here.
Gotta have your brains.
But it just makes more difficult surgeries so much easier. It
Wow.
is so easy. Look at that. I mean, you just put your fingers in these little loops, and you're totally in touch with the robot. You feel like these are your hands. And different from regular laparoscopy, where the instruments are usually a little bit more stiff, this has such a range of motion that you can feel and that you can move with. The 3D, really having depth perception. You can see and visualize so much better.
Every OR in the country isn't going to have this machine. Obviously, this is expensive.
Only 8% of ORs currently have it, and I believe in the future, every OR in the country and every gynecologist who intends to practice, this is the way they'll be doing hysterectomies.
This is the future.
Is this something that you would consider?
Absolutely. Absolutely. My question is the recovery. You were saying it's a shorter recovery. Yes. Can you expound upon that for me?
I do. I do your surgery. Normally, I operate on Tuesdays. Wednesday morning at 7 o'clock. I walk in. They're usually sitting up in bed, waving. Can I go home now? We get you home. See you back a week later in the office. If you're ready to go back to work, I send you back to work. 2 to 3 weeks, you're completely doing normal things.
And you can actually ask her all of these questions on your own because Dr. Levine is from your home state and has agreed to meet with you to discuss